Hi everyone, Dr. Mak with another video today. I'm answering one of your asked questions. And again, we have started the Ask Dr. Mak series in which if you ask me a question regarding coming to Australia or doing the ADC exams or anything related to it, you DM me a question, I'm going to answer that. Okay? And I'll make another YouTube video because it's better to do it this way and answer that question for everyone rather than just answering DM everyone, which is really hard for me to get back to everybody. So this question was asked by one of the girls from India. Again, it's anonymous, so I don't want to take the name out. And the question is that I am an oral and maxillofacial surgeon in Australia and in overseas, not in Australia, sorry. So I'm an oral and maxillofacial surgeon in overseas and I want to become a oral MAXFAC in Australia. Or I'm pursuing my oral and maxillofacial journey in India or in Pakistan or wherever you are in Brazil. And later in the future, I want to come to Australia. So what is the way to come and become an oral and registered oral and MAXFAC here in Australia? And the thing is, it gets a bit technical, because some overseas countries, they don't require you to do a full MBBS before you start your oral MAXFAC. Some countries tell you that you can just do a 3 years MBBS because you've already studied anatomy, physiology, all that, and your BDS in the first 2 years. So we're just going to waive those 2 years and you only do 3 years. Some overseas countries tell you, no, if you want to be a registered oral maxillofacial surgeon, you have to do the full MBBS and the full BDS. After that, you need to do the maxillofacial training, which is another 5 years. Now, let's talk about Australia or some of the countries which have their set pattern. If you want to become an oral and maxillofacial surgeon, you need to do MBBS 5 years, you need to do BDS 5 years. You can do it in whichever pattern you want to do, like BDS first or MBBS first, doesn't matter. So you have 5 years BDS, you have a 5 years MBBS, and then you go and apply for your maxillofacial training, which is another 5 years. So it includes 15 years. Now, if someone tells me that actually in my country, I didn't have to do MBBS, or I only did 3 years MBBS, Australia may not allow it. Or America may not allow it. So it depends which country you're going. Now, if someone says that I have done a full MBBS and a full BDS, and now I'm a maxillofacial, what to do? So then in that way, what you have to do to come to Australia and become a maxillofacial would be get your BDS and MBBS recognized here. So for example, you do the ADC exam and get your BDS recognized, might take you 3 years or 5 years or 2 years, depends. Then you do the MBBS, which is AMC exam, Australian Medical Council exam, like the ADC exam. You get your medicine degree recognized. Once both the BDS and MBBS are recognized and Australia has said, yes, you are fully recognized now with both your degrees, then you can start your training. So now the question arrives is, do you want to do the ADC and AMC and then do the maxillofacial? Or you don't want to do that, you just want to become an oral surgeon? Because a lot of countries in which you haven't done a full MBBS and you've done a maxillofacial training, maybe in your country you can call yourself an oral and maxillofacial surgeon, but in Australia, in a recognized country, and I'm not trying to say that you're not an oral maxillofacial, I'm just saying there's a set pattern, what everybody follows. If you haven't done the MBBS, then if you're coming from overseas and trying to set your footsteps in Australia, then you'll be considered as an oral surgeon, not an oral MAXFAC, because you haven't done MBBS. And if you want to work as an oral surgeon, then you can always do the ADC exams, get yourself recognized, and then maybe you can go to an oral surgeon postgrad. that will work really well. But then if you say, no, I want to do the full oral maxillofacial, then ideally you need MBBS. If you've already done MBBS, great. If you haven't done, then you'll have to do it again. If you have done it already, then again, to get it recognized in Australia, you have to do the AMC exam as well, and then the ADC exam. And from there, you start your 4 years or 5 years maxillofacial training. I think it's 4 years. Depends where you're going. Maybe a bit of apprenticeship or registrarship. I think it's 1 year of that as well. So it's different which school or which program you apply. But again, things change as well. So as I always say, keep on top of your knowledge as well. I've researched things my way. Maybe when you research something new, you might find something new and might be something is changing now. So I'm telling you things on the basis of my knowledge. Doesn't mean I'm saying 100% right. You'll have to check those with the universities, with the program directors. Now, the third thing is to get into any of the fellowship programs. Not about declinton and stuff. No, I'm not talking about the clinical program. I'm talking about the fellowship program, like endodontist or maxillofacial or prosthodontist. The fellowship program, they're only for their Australian citizens. Even if you're a permanent resident, you can't get into the program. So most of the programs are for the Australian citizens only. And that's as far as I know. So then you might do BDS and then you might do AMC, and now you want to start your maxillofacial training and they might tell you you're not a citizen yet, so you can't get through. So then you might have to work either a doctor or like a medical practitioner, or you can work as a dental practitioner or a dentist, same dental practitioner, and you can get your citizenship first and then apply for the program. So it's a lot of technical aspects. I hope you get a clear mind now. If you want to become an oral MAXFAC in Australia and get yourself recognized, first you need a BDS, you need a full MBBS, and then you need the oral maxillofacial training. Now, if someone says, I've done BDS, but I have done half MBBS, then Australia might not recognize you. Because again, for the AMC, you need a 5 years MBBS from an overseas country. If you say no, 3 years and they've recognized, like waived it off, maybe in your country they waived it off, maybe here they won't. So then check with Australia. You need both MBBS, you need both BDS, and then if someone says that I have already an oral MAXFAC from India or from Brazil or from Sweden or Pakistan or wherever you're coming from, then check with them. Is it a 3 years training? Is it a 5 years training? Is it a recognized training or not? Because maybe Australia says that, yeah, it's a great training if you've learned, but maybe we don't recognize it. So then you might have to do it again. So if you are an oral and maxillofacial surgeon in your country, and if you want to come to Australia, then these are the factors you need to consider first. Are you a citizen? Are you a permanent resident? How long is it going to take you to do a citizenship? How long is it going to take you to do an ADC? How long is it going to take you to do your AMC? How long is it going to take you to get your postgrad fellowship oral MAXFAC program? Is it worth just staying as an oral surgeon? Or do you really want to be an oral and maxillofacial surgeon? Because there's a difference to it. A lot of times we don't understand the difference between oral surgeon and oral and maxillofacial surgeon. There's a big line that you have to draw in the middle. So ask these questions to yourself. Think about it. Make some points. Look, how many years can you give? How many years do you want to give? It's not just about how many years can you give. How many years do you want to give? Do you want to study enough other 15 years doing all that? If someone wants to and is passionate, that's amazing. You can even give 30 more years. We study all our lives. But that's the factors we need to understand and we need to acknowledge. And we need to sit down and actually think about it before you want to pursue. So coming to Australia as a dentist and then doing the ADC exams and becoming a dentist. But then if you have the MBBS, then you do the same process for that as well. And once you get it qualified, then you can start into the program. And most of the declinton program, they're for oral surgery. They're not for oral maxillofacial Oral maxillofacial, they're mostly the fellowship programs, and for those you either need to be citizens to apply in that country. And things can change. You can always email the course coordinators and the universities and the Australian Dental Council or the Oral MAXFAC department and see how things are running, how you can get into the programs. They're really good. They always reply to email. They always get the format. Google it, research about it. But that's how things work. So again, for the person who asked me this question from India, I hope that answers your question. For all of you who have some questions in mind, and if you feel that, I really want to know about certain things, I'm getting confused, DM me or comment in the video below about your question about coming to Australia or related to the exams or anything you have in mind, and I will try my best to answer that and include that in the next upcoming video. I hope that helps, and take care. God bless you all, and I'll see you all in the next video. Take care.